Okay. Good evening, everybody. Welcome to the April meeting of the City of Binghamton Planning Commission. My name is Chris Jejits, and I am the Vice Chair of the Commission and will be acting as Chair tonight. The Planning Commission is a 7-member commission comprised of local community members tasked with reviewing special use permits and site plans for consistency with the standards and criteria set forth in the zoning code. Based on our total number of Planning Commission members, 4 must be present for a quorum. It looks like we have 4, but we're going to do a roll call just to confirm that. Nick Corcoran is absent and Mario DeFulvio are absent. Chris Jejits, I am here. Emmanuel Priest.
Here I am.
Okay.
Rock me like a hurricane.
Thank you. Kelly Weiss. And our newest member, Kyle Nedlick. Okay. Welcome to the jungle, to quote Guns N' Roses. And we also have Joe D'Angelo as our alternate.
Sure.
Okay, perfect. We do have quorum, so we will move on to the first item on the agenda, which is the approval of minutes. Minutes were circulated. Does anybody have any questions, comments, corrections, alterations for the minutes?
I'll make a motion to approve.
Okay, a motion to approve the minutes as submitted. Do I see a second? Joe, thank you very much. All those in favor of approving the minutes as submitted, raise your hand and say aye.
Aye.
Aye. Okay, so we'll have 1 abstention from Kelly. Okay, so that's 4 yeses, no negatives, and 1 abstention. Okay. Next on the agenda are SEQR determinations. In this portion of the meeting, the Planning Commission will be reviewing documentation provided by applicants for the first time. Applicants will be asked to step to the microphone and make a presentation to the commission describing their plans. Commission members may then ask questions to the applicant about the project. The commission will then deliberate and then either set a public hearing date for the project or request additional information before proceeding. For all applicants, that we ask that you or anyone with you, engineers, architects, attorneys, etc., please identify yourself with a name and address for the public record before beginning your presentation. So our first SEQR determination today is the applicant is the Family Enrichment Network. The project address is 245-249 Washington Street. Hi.
Good evening. I'm Kenneth Gay. I'm a senior architect at Keystone Associates at 58 Exchange Street. I'm here on behalf of the Family Enrichment Network tonight to discuss their plans for 245 through 249 Washington Street, also known as the First Assembly of God's City Church, if you know the area. They are in the process of purchasing the southern building. There's 2 buildings there. They are only looking at the southern building, which is the one that is part of the parking lot. The parking lot is part of their sale as well. They are anticipating in the initial phase to put early Head Start and Head Start programs on the, I'll call it the street level. The street level floor is just slightly up about 4 feet from the street level, but it's the first floor and the second floor of the 5-story building. At this point, they're looking at adding early Head Start and Head Start, as I mentioned. I'll go through that in a moment. The parking lot area will be left as is, except for an area adjacent to the building, as on the plan that you have. It was going to be on the south side of the building. We'll put in 2 age-appropriate playground areas for Head Start preschool area, and then also an infant/toddler outdoor play area. They will be seeking the appropriate licensing from New York State for this as well. The parking area as off-street parking, like I said, we'll keep the traffic flow similar to what it is. Entrance off of Washington, one way out to Water Street. That's how they would like to program it, and it's best because they can maintain the existing striping there. We will take up some parking spaces for the playground areas, and then we've reconfigured the accessible parking spaces so they're in current and in with the current code. We'd also like to request an area in the front for 3 van drop-off spaces that's shown on the floor plan. Right now it's in the, we'd rather not bring the buses through the parking lot that drop off the children there. So that's the site plan. Inside, as I said, we're going to occupy 2 floors. The first floor, we're relatively keeping the floor plans the same. There's no addition to the building. On the first floor, we're removing a few walls, but the building's pretty much set up already for classroom space. So as you'll see on the first floor plan, everybody's got that in front of them. If you'd like me to turn it, I can do that. On the first floor plan, we'll have infant and toddler early head start programs consisting of 48 children in 6 different classrooms. And we will be adding appropriate toilet facilities, diaper changing areas to those plans as well within each of the classrooms. On the first floor, to round it out, will be the lobby and reception area for student drop-off, meeting spaces, and director's offices. Up on the second floor, as I said, this is a 5-story building, with these being the 2 in the middle. I guess it's not the middle, but there's still 2 above. Will be Head Start program. Right now, they anticipate 2 Head Start classrooms being able to occupy those on this floor. However, we have shown a 3rd one because they do anticipate that being a future use for the building. Now, there'll be 50 children in these 3 classrooms on this floor. There'll also be support spaces on the second floor for break rooms, mechanical rooms, meeting rooms, as well as office space on this floor as well. The building does have an elevator that will be maintained. We will be adding a complete sprinkler system to the building and an additional standpipe, which are code requirements for our occupancies. Anything else?
Okay. If you have nothing else as the presenter, I'll turn it over to members of the commission. Are there any questions for the applicant? I actually have a question. Considering both parking and I guess under one of the standards, the compatibility with the general character of the neighborhood. So currently, the parking lot is under some sort of agreement with the Forum Theater for them to use when there are performances at the Forum Theater, the current owners. Do you know if Family Enrichment Network might be interested in continuing that?
My understanding is that they will be.
Okay.
It will be a source of revenue for them. So
Okay.
I would assume they would. Yeah,
Okay.
they've expressed.
Is there anybody else here from Family Enrichment besides
No.
yourself? Okay. Are there any other questions?
What will the hours of operation be?
Typically it would be, I would think before school they'll be dropped off. Some are bused there as well. And then there's no after school programs that I'm aware of. If you would like, I can get a better determination of that. You know what, it might be in the application. They're going to continue, they're going to, this will be a relocation of their existing spaces that they have at various facilities, but in this case, they'll now own it. So they'll maintain those same type of hours of operations that they have.
Okay. I think my only other question would be the van drop-off spaces after hours. Would that be public parking?
I would like to do that. They'll be, I would think, designated hours that they'd like to do that. We just want to keep the buses and the children safe, you know, as everyone does. I don't
Sure.
think anybody would say no to that.
Will the construction will be sidewalk, need to be closed off or will we should put affect the sidewalk?
No, there will not. Right now, there exists a ramp on the south side of the building, which we'll maintain because it provides accessibility up to the level. As I said, it's kind of a split level building. So we'll maintain that and there'll be no changes to the sidewalk or anything in that matter. No.
Anybody else? You all good? Okay.
Chris, one
Oh,
quick thing.
yes,
is
Tito.
If I understood correctly, they want to reserve sort of a loading zone in front of the parking area for buses.
That's correct. Yeah.
Okay, that would just need traffic board review, but that can happen between now and the next meeting.
you can direct the applicant to the appropriate process to get that traffic board review papers that need to be filed and documents and, okay. All right, well, pending that traffic board review, I guess our next step will be, because this, we're gonna have I'll gladly take a motion to declare this proposal as a type 2 action under SEQR and that no further environmental review is required. Kelly, with the motion, do I see a second? Okay, all those in favor of declaring this a type 2 action under SEQR and no further environmental review being required, raise your hand and say aye.
Aye.
Okay, we got 5 yes, none opposed. Well, then, I'll take a motion to schedule a public hearing for May for this project. See a motion from Manny and a second from Kyle. All right, all those in favor of holding a public hearing for this project in May?
Aye.
Aye, okay, 5-0. We'll see you in May. We'll tentatively say 5:20. We'll schedule it.
All right, thank you.
You're welcome. I think that's the only secret determination we have tonight. So now we'll be moving on to public hearings. Applicants will be asked to step to the microphone and make a brief presentation to the commission describing their project. For most of these projects, this is the second time we are reviewing your plans. So it will be helpful if you provided a brief update and clearly identify any changes that have been made since you were here the last time before the commission. Once the applicant is done presenting and any changes have been reviewed, we will open the public hearing and allow members of the community to speak about the applicant's proposal. After the commission has heard all community members interested in speaking tonight, the public hearing will be closed and the commission will deliberate and possibly make a final decision. For all applicants, we ask that you and anyone with you, engineers, architects, attorneys, etc., please identify yourself with your name and address for the public record before beginning your presentation. And likewise, for all community members, if you're here for one of the various public hearings tonight, we would ask you to identify yourself with a name and an address for the public record before you begin your public comments or your comments at the public hearings. And we would ask that you limit your comments to 5 minutes. All right, so up on the agenda tonight, our first public hearing, as I pull back up my agenda, is the Mental Health Association of the Southern Tier. Project address is 34 West State Street. Hi.
Hello, Sarah Campbell with Hibman Howard and Kittel, also with Megan Crow, the Executive Director of the Mental Health Association of the Southern Tier. As you've indicated, this is an application for site plan and special permit for social services use at what we probably more commonly know as the old CVS on State Street in the plaza across from the old Binghamton Plaza. Nothing has changed since our prior meeting with you. This is a supportive crisis stabilization center, a clinically based, peer-based facility for behavioral health and substance abuse crisis. This is for a population of not more than 20 individuals, 10 adults and 10 minors, although at the present time, the organization has approval and funding for 5 adults and 5 minors. We do have the space in the building to house the additional or to service the additional individuals, and that is why we put 10 and 10. We don't want to have to come back should we expand into the larger space. This is a program that allows services for 24 hours and 59 minutes. 23 hours and 59 minutes. A 24-hour program is not part of this proposal. And then if services are needed beyond those crisis services, MHAS has a variety of other programs for longer services. The goal here really is to get people over the immediate crisis and then to connect them with services moving forward. That's our presentation. Again, nothing has changed. And I think you had 2 issues that I did want to address. One was the location of the dumpster. We've plastered around a little GIS map just showing you on the back in the red X where that is. And then the second was some repair of a sidewalk, and we're happy to do that as well. That was a staff recommendation.
Are there any questions from the commissioners before we open the public hearing? Okay, I'll let you folks step away from the mic, and at this point, we'll be opening the public hearing for the applicant, the Mental Health Association of the Southern Tier, with a project address at 34 West State Street. Is there anybody here tonight who'd like to speak on this specific project? Oh, well, they'll take the gentleman here in the blue suit, and sir, if you and the black windbreaker want to get ready, you're up on deck.
Thank you. Good evening. My name is Patrick Gary. I'm a resident of the town of Union. I've served on the MHAS Board of Directors for about 3 years, and I'm currently the Chief of Police in the Village of Endicott. And I'm going to try to stick to my lane of experience with the Crisis Stabilization Center here from a law enforcement perspective and the needs as it relates to the community. But based on my positions on the board and law enforcement, I sit in a unique place to see the work of MHAS from 2 different sides. And I also have some insight into the gaps for mental health in the community. It's no secret that mental health issues are a primary concern for local government and certainly for law enforcement. Anecdotally, I can say in my 34 years that of policing experience that a large percentage of the violent crime, drug use and abuse, general crimes, disorder that I've experienced have been in some way related to mental health issues. As an organization, MHAS, working collectively with our partners, has done an outstanding job in responding to and treating mental health disorders that contribute to these issues. And they've really only been limited by funding. MHAS is there for law enforcement when a person doesn't meet the criteria to take them into custody, but officers can't or don't want to walk away because they're also community stewards who know someone's in crisis and they need help. The mobile crisis team is an outstanding resource and we use them often. But because of the gaps in the system, there are many people that fall through the cracks who are experiencing mental health crises of some sort, or they need mental health assistance. But because they're not a danger to themselves or others at the moment, CPEP is not an option for them. Officers throughout the county often face a choice between convincing a person to go to CPEP voluntarily or walking away from the scene, knowing they're leaving a person vulnerable or that they'll be dealing with them again just a short time later. There's some literature I think that you may have received last time, but if you have not, in a project summary, it explains that in 2021, there were 5,106 visits to CPEP, but only 1,563 individuals were actually admitted. That left 3,543 individuals who could have benefited from some form of mental health care. Not in the literature, but also in 2021, according to Broome County Law Enforcement Records Management, there were 2,373 calls that police responded to that were labeled a mental health law incident. That's about the yearly average for law enforcement in Broome County, with about 1,000 of those in the city of Binghamton and about 250 in the village of Endicott. And while I'm sure all or at least many of those incidents are included in that 5,100 CPEP visits, the numbers demonstrate that law enforcement is responding to mental health calls while lacking community resources to properly assist those in need. Now, I realize that anytime an organization comes into a community and wants to set up a facility that deals with human services, there can be a knee-jerk reaction for people to wonder what impact it's going to have on the community. Are these people going to settle in the location? Are they going to ruin the neighborhood? It's a completely understandable reaction and it's a legitimate concern. And if I lived in the district or if I were the chief of police in the city of Binghamton, I'd have the same questions. And because of that, I reached out to a counterpart in the city of Poughkeepsie, Chief of Police Tom Pace, who has the Dutchess County Stabilization Center that sits right in Poughkeepsie. Chief Pace advised me that their stabilization center has had no negative impact on the area. People do not come for services and then stay in the area. They actually go back home. He explained that most of the clients there are actually from the city of Poughkeepsie or the town of Poughkeepsie because the services primarily are right there and those people have the greatest need. But he said even people from out of town and juveniles do not affect the neighborhood. He did describe some learning curve moments early in the process when different administrators running the facility refused to accept certain patients. That was especially during COVID, which law enforcement wanted them to take more patients. But his message was clear. The center is an outstanding resource when they don't want to arrest someone, when they have nothing to arrest them for, or they need to find someone immediate services and there are no other options available. He stated the center has definitely been an asset for both the city and the county. So I want to thank you all for your time and attention to the matter, and I appreciate the consideration you're giving, and I respectfully ask for your support on behalf of both law enforcement and the Mental Health Association of the Southern Tier. Thank you.
Okay, sir, would you like to, you're next in line?
Ron Borgna, Borgna. I live at 456 Shenango Street, Binghamton. This is right up the street from the old CVS, which is proposed for the MHAS facility. I've lived there for 43 years. It's my home. I'm proud of it. I take care of it. It's where my family lives, and it's my investment. But I'm all in favor of helping people who are in mental health crisis. However, from what I've read in the newspaper, what I've heard on the radio, and what emails I've gotten from people in a position of authority, it really doesn't sound all that helpful, in my opinion. Okay, first of all, I asked if there was going to be a physician on site. I mean, I think somebody who has a mental health crisis, they might need a physician or a physician's assistant or a nurse practitioner. The answer was a whole list of counselors. I would think somebody would need a doctor or somebody who would prescribe medicine if they needed it, or somebody who was trained to administer medication to somebody. So there, to me, if they're not having a doctor there or a psychologist or a psychiatrist, how is that helpful to people, just to go and sit with a counselor and talk? That's not really that helpful to me. Also, I was told that along with the social workers, there'd be RNs there, plural RNs. Well, good luck finding RNs in our area. Every facility, whether it's an assisted living facility, state-run IRA group home, they have a hard time finding registered nurses. Maybe they could get a couple LPNs, but that wasn't even on the list of the staff that would be there. So to me, it's understaffed in that sense. I also asked if there would be security personnel there. I mean, we know the world that we live in today, everybody has security. You go to a grocery store, they have security. You go to Lowe's or Home Depot, they have security. And I was told no security personnel, only security features. Well, what is that, a euphemism for a door with a bell? So where's the security there in that facility? I would think people would need security. If you're in a crisis, you would need security. No security personnel. All right. And then I wondered about the training. And I was told they have multiple layers of training. Are they trained to deal with somebody who's developmentally disabled versus somebody who's like in a real crisis and could be violent? Do they know the difference? And where is this training? Is it on site, or is it just sitting in a classroom once in a while? So it sounds like they're not trained either that well. Oh, and then I've spoken to many neighbors, and everyone was shocked to hear that this facility is going to draw people from 7 other counties in this area. Steuben, Schuyler, they're on the other side of Elmira. Why can't somebody in that area go to Elmira? Everybody says 7 counties. Why are they being drawn from such a big area to come to Binghamton and the north side of Binghamton yet? Not that we don't have enough like things going on the north side now. I mean, it's typical. We have police in the neighborhood at least twice a week in that neighborhood along Shenango Street. I'm usually woke up at 3 o'clock in the morning, open my eyes, and I see the red lights going on the bedroom ceiling from all the police cars that are there. But to bring people from 7 counties, I'd hate to be in a mental health crisis out on the 40 miles from Elmira, and somebody will say, you know, get in a minivan or in an ambulance or a police car and just wait it out till we get to Binghamton so you could talk to a counselor. 7 counties and brought here, why don't those, there's hospitals in Elmira. There's a hospital in Shenango County that they're going to draw from. There's hospitals why don't they have facilities to help people? Why are they all going to be coming to Binghamton and to my north side neighborhood? I mean, why? I mean, why don't they try to help their own people? And then those people would have to be transported. So let's face it, if they're coming from past Elmira, they'll get on Route 17, get off on Upper Front Street, the Front Street ramp, go up Front Street, across Bevere Street, and down Shenango Street. 24 hours a day, 7 days a week. Police vehicles, medical vans, ambulances. I mean, I wouldn't think they'd have their sirens on or lights, but maybe they will. I don't know. All coming down that street. On one hand, the city of Binghamton wants to curb these mopeds and motorized vehicles that are going up and down the street. I mean, we know of 3 vehicles that just zip up and down Shenango Street constantly. They start at the light on State Street and go and just gun it and go all the way up to Bevere Street. Nobody does anything about it. There's nobody around to ticket them or anything or slow them down or anything like that. And now on top of it, you're going to add ambulances, police cars, and medical vans 24 hours a day, 7 days a week. And I mean, if there's 10 people there, they have to be transported back and forth. Somebody has to do that. Before I go any further about the security thing and the thing about the security features, how could, I mean, suppose somebody was in a crisis and they didn't want to stay there. Nobody's there to administer medication to them that they need. And they see a door and they say, I'm just going to push my way through the door, and a bell goes off and they go outside where people are standing waiting for a bus or children are waiting for the school bus. That's a problem waiting to happen, I think, here. Approving this thing is just a problem waiting to happen. I know you're trying to stop me. Am I over my 5 minutes? Okay, I could talk fast. Okay. So that would greatly increase the traffic on Shenango Street. And oh yeah, saturation law or code or ordinance, whatever it is, there's 2 other facilities in that area. Volunteers of America run a residential facility at 320 Shenango Street in the Old North Presbyterian Church. That's a residential facility. At 448 Shenango Street, OPWDD runs a group home, an IRA. That's a residential facility. This facility would be 1 block from the Volunteers of America facility and 3 blocks from the state-run IRA there. And then when I was given an answer, and it was mentioned here today by somebody, that it's not residential, it's not 24 hours a day, it's 23 hours and 59 minutes. What kind of an answer is that? Is that just a wise guy answer? To say that to somebody, are they going to be standing by the door with a stopwatch and telling somebody, well, you have 58 seconds, 57, 56, 55, hurry up, get out the door. So we found this loophole to circumvent the law and just say it's 23 hours and 59 minutes. I never heard of such a thing. Why would somebody even say that?
Thank you, sir, for sharing your thoughts.
All right, thanks for listening.
Anybody else who'd like to speak on this project? Yes.
Hi, my name's Rosanna Getson. Last name is spelled Gecan. I'm here representing Care Compass Network, which is headquartered at 33 Lewis Drive in Binghamton, and also as a person with lived experience with behavioral health conditions. Sure, yes. So Care Compass Network, the organization I work for, was involved in helping put together the grant application for this project. And as I think you know, there are going to be 1 supportive crisis stabilization center as well as 1 intensive crisis stabilization center in each of the regions in New York State. Clearly, OMH and OASIS are very committed to expanding access to these services for people who are high risk and very vulnerable, and diverting from hospital-based services. I'll speak to a couple of things that the gentleman before me said in a moment, but the first thing I want to speak to is as a person with lived experience from a health equity perspective. I've been in the healthcare industry for 25 years. I'm someone who has diagnosed bipolar, anxiety, and PTSD, and am fortunately a functioning adult. But I've been deeply involved in helping develop programs to support this population. And there's no question that there's a significant shortage of resources for individuals who struggle with these conditions. There's stigma, there's implicit bias, there's all kinds of barriers that people who have these unfortunate circumstances have to deal with in order to access care in the same way that someone who doesn't have these would, right? So I'll give an analogy. So sometimes I think people feel like someone who has opioid use disorder is, they're making a choice to have this addiction, or they're, they had a bad hand dealt to them. It's really no different than someone who had diabetes that's dependent on insulin. It's the same exact thing. It's a chronic relapsing condition that requires ongoing medication. And so for us to treat those people differently than we do somebody who has a medical condition is just wrong. It's not morally correct. It's the wrong thing to do. And I think as people who live in this community, we're obligated to make sure that we serve everyone equally and give people equal access to quality healthcare, regardless of what their personal circumstances are. In terms of the specifics of the center itself, this center, since it's a step down from the intensive, does not require on-site physician support, but it does require on-call psychiatric services 24/7 a day. So if someone does let's say an RN does an intake, they find that somebody has a higher level of care need, they will immediately contact a psychiatrist or the nurse practitioner or psychiatrist that's on call to do a further assessment to make sure they can determine next course of care if there's a higher level of care that's needed for that individual. And they can also do medication management. So it's not correct that that level of service isn't available. It absolutely is. The other issue related to staffing, clinical staffing, 100% agree. We are struggling with one of the worst workforce shortages that the healthcare industry has ever faced in its history. And so we've thought about that, and our plan is MHAS is going to be working with a community health system partner to provide the nursing staff for this center for a couple of reasons. One, they're going to be more likely to recruit and retain and hire at wages that would be comparable with what the market is bearing. But also, it's really important that we don't operate in silos, right? So to deploy these services and have MHAS operate, as a community-based organization and not integrate with UHS and LORDS and all the other services that are available would not really ultimately benefit the community in the best way. So by integrating and collaborating the staffing piece of that, we're really kind of building in that partnership and collaboration between the health systems and the community-based organization. Let's see what else. Yeah, so I guess the last thing I'll say is I understand your perspective as somebody living in this community. The bottom line is, and I think I would urge you to think of it this way, these people are going to exist whether or not these services are available. In fact, the circumstances and their conditions being exacerbated are going to be far more likely if these services aren't available. And it's definitely not true that you're going to see an influx from 7 counties because it's just not practical, right? So the center itself has a maximum capacity. It's only going to be able to serve, certain number of people per day. And so I understand why it would be, you could imagine that there'd be people coming in from all these different places, but that's just not the way it's going to be. The first kind of default is going to be what resources are available to people in their local community. As someone who has experienced both the inpatient and outpatient side of behavioral health as a patient, I can say no one wants to travel out of their hometown to receive
Okay, Miss,
services.
I don't mean to interrupt you, but your allotted minutes is up.
Okay, well, thank you for your time and consideration.
Thank you. Are there any other speakers tonight on this application for 34 West State Street?
Hello. Nate Hotchkiss, I'm the representative for District 4. I just wanted to vocalize my support for this project. In my short time on being on city council, there's already been multiple instances of attempted suicide and self-harm that I've been made aware of, and I don't think that's something and that's been right in my neighborhood. And I would like there to be services available to prevent those things from happening, and I think this would help to achieve that. Additionally, I've knocked on a lot of doors, and there's a clear lack of services that are available that will help people with their mental health issues. And there's from my perspective and the people that I've spoke to, that there is a desire to increase the accessibility of mental health services. So again, I support this project, and I think it would help to bridge the gap between the services that are needed and the demand that's in the community. So that's all, short and sweet. Thank you.
Okay, thank you. Are there any other speakers for this public hearing on the project at 34 West State Street? Going once, going twice? Okay, I will declare this public hearing closed.
Chris, I just want to know
Oh,
for the record.
Yes, please.
We got one letter of support from Assemblywoman Donna Lupardo, which is on base camp, and one letter in opposition from Mr. Bornia, who spoke here today.
Thank you. All right, Ms. Campbell, would you and your colleague there from MHAS like to address any of the topics or issues that were brought up during the public hearing?
Just quickly, just to sort of refresh everyone's recollection, this is a very limited program in terms of size, obviously, starting out with 10, possibly growing to 20, but that would be the maximum just because of the space limitation. And also, I mean, this is not a casual encounter program. This is a program that is jointly certified and licensed by the New York State Office of Mental Health and the Office of Addiction Services. These people are highly trained in crisis escalation, in peer management. And obviously you can tell by the previous speakers that there is a hierarchy of individuals available both on site and then on a consulting basis for essentially whatever walks through the door. And it's just not accurate to suggest that everybody coming there is coming by an ambulance or from the police department. People are coming. This is a voluntary program. This is not a court-ordered program or a kind of a lockup program. This is a voluntary program. People are having an issue. They are dealt with in the immediate circumstance. And then really, in my opinion, what the meat of the program is connections to services moving forward. It is not something where someone's going to be there for weeks on end. It didn't mean to be facetious in any way about the time limit, just to explain that the licensing requirement does not permit any sort of overnight anything beyond almost 24 hours. So it is certainly expected that people will be coming, getting connected to services, leaving, and then other people will take their place. So in terms of traffic, I think, that's not a realistic problem. We're talking about a very small number of individuals. And then I think that was it. Was there anything you wanted to add?
I was just going to add, to speak and reiterate what Sarah has. Sorry. Just to reiterate what Sarah already said, we are licensed to operate by the Office of Mental Health and the Office of Addiction Services and Supports. Therefore, we have to follow all of the regulations that they set out for this program. They are very comprehensive with security, transportation, the region that we operate and serve, the types and credentials of the staff that we employ, the training that we provide to those licensed staff. So I just want to reiterate that we have to follow those guidelines. And of course, New York State has outlined those for all supportive and intensive crisis stabilization centers. So although we may wish to do more or maybe do less, we are mandated to follow and adhere to those to maintain our licensure.
Okay, so, sir, I'm just gonna say this, the public hearing is closed. Because the applicants now are speaking to the commissioners. Now, we're gonna ask a variety of questions, but at this point, the public hearing is closed. Anybody's welcome to remain as an audience member and watch the rest of us on the planning commission ask further questions of the applicants. Okay. All right, do any members of the planning commission have questions? Yes, Kelly, go ahead, please.
I have a few, but I think that they're all kind of in the same genre. So to address the security, but will there be anybody at the door for security? I know you're saying that there's a level of training, so are we to assume that the front desk people have an extra level of training for that security?
So the building design itself has a double entrance, a double door entrance. So the first entrance will be open.
Okay.
The second entrance will be locked. We have security cameras that will be throughout the building. And we have only an open waiting area that's accessible to any clients coming in. Otherwise, everything is a badge swipe access for the common areas, the triage rooms, the general private rooms for any clients. The intent of the center is obviously to be a safe space, a welcoming space. We also don't want to overwhelm anyone with a variety of security features. We're actually bound by what the state sets out for us, where we can't screen anybody like metal detectors or anything like that. So upon opening our center, we do have the ability to potentially hire a security employee to be at that entrance of the building. At this point, we haven't implemented that just because we want it to be a welcoming space. But depending on what we see after we're in operations, we can implement a personnel to provide that extra layer of security. Otherwise, it's just all within the building features.
Okay. My next question is, so there'll be people from different counties coming. First of all, with the limited staffing capacities and ability to take care of only so many people, how do you communicate with the other counties about what level that you're at with saturation?
As far as capacity for the center, even though they have the ability to stay up to that 23 hours, 59 minutes.
That's- I'm wondering if you only can take 10 people. So
Right.
how do you all communicate about, how do you know?
Right.
So
Well,
sorry.
that's okay. I just wanted to express that there will be like a continuous turnover
Okay.
of clients because of that 23-hour window. And our waiting space will allow people to wait for an available room to be seen and treated, counseled, and to see what we can do to support that person. We'll have relationships with the various county departments, county healthcare systems. But because of that turnover, it's not anticipated that we'll be unable to serve somebody within a reasonable amount of time of their arrival.
And that was my next question. If you were over capacity, would you be turning people away or would they be staying? So they would be able to stay in this situation. So we could get above that capacity then.
Correct. The
Okay.
waiting area will be open for
Okay.
them to wait. And again, we have a triage room, we have exam rooms, we have plenty of space for a person to wait
Okay.
to be officially admitted based on that turnover.
And another question then is, if people were coming from a different county and relied on a level of services that you've determined, will they be then transported back to their own county for those services, or will they remain in our county and our city for those services?
Correct. The intent of the program is to connect that individual to the resources in their home community. So depending on how they arrived, that would be the way that they would return to their home community with our case managers on staff, making those connections and referrals for the services that they need. If those services aren't available in their community, they may be referred to another community to get those services, but it's not intended for anyone to stay in this county. They would return to their home area.
Okay, thank you so much.
Questions and comments? Yes.
That comment about the noise during transport. Would a transport facility typically require silent starts, or would it be more of a silent?
This was actually something that we talked about at the last meeting and addressed because we have to keep in mind that this is a voluntary program. So it would not be anticipated that people are coming under duress or, in the sense of an emergent ambulance or police service. They can certainly come to us that way, but they're also going to ride the bus. They're going to come with a family member. They're going to come with somebody that supports them. They're going to drive themselves, perhaps. It could be a variety of ways. So it's not a program that relies on an EMS system for people to get our services.
I got a couple questions from comments and questions that were raised at the public hearing a few minutes ago. One of the speakers referenced nearby Volunteer of America facilities and a nearby OPWDD facility. I am not as familiar with the social services matrix. Can you describe how those facilities are similar or different, and how they meet similar needs or different needs than what the MHAS facility will be doing?
Sure. So those facilities are also regulated by a New York State agency and have requirements to meet for licensure. However, those, I believe, are both residential programs. This is not considered a residential program. This is considered a clinically based crisis intervention program. So that's the biggest difference. I believe that was indicative of the idea of saturation. I worked in OPWDD for 12 years, so I know that the requirements for residential programs cannot be overly saturated with those residential programs in any one given community. And this does not meet that definition or the concern for saturation, because we're a totally different type of program.
The other question, and I know we did talk about this at the last meeting, but just so we can refresh everybody's memory, can you go a little bit more in detail about what the staffing is going to be? There were some questions from multiple speakers at the public hearing about physicians on site, physicians on call, the level of registered nurses that are going to be on site. Can you just go over that in a little detail as to what the staffing will be?
So the staff will obviously be required to be present for 24/7, 365 because of the operation of the program itself. The regulatory guidance requires us to have an RN on shift for those full 24 hours of each day for assessment and medical observation or assessment of need, and also to determine if anyone needs a higher level of care upon their arrival. We also will have a licensed social worker, perhaps a licensed master social worker or a licensed clinical social worker. Either one fits the requirements. We will have a credentialed alcohol, substance, and abuse counselor to address any needs on the substance use disorder side. We will have case managers that are going to be familiar with the resources of every community to link those clients to services upon discharge. We will have a program director that will be responsible for the day-to-day oversight and management of all of the staff and the operations. And we will also have a director of clinical care which is for our entire agency, but will be required to supervise the operations of this facility, as well as provide the clinical supervision for those licensed employees. So we plan to have anywhere between 3 to 4 staff per shift for those full 24 hours based on that criteria that I just reviewed from New York State regulations.
In a worst case scenario, and you mentioned like one of the requirements is you're required to have an RN on site. What happens if your RN who is scheduled to be on site working for that 8 or 12-hour shift calls in sick, quits because they get a better paying job somewhere else? What is the fail safe? Do you close the doors? What happens if in that worst case scenario?
Correct. We won't close. I also forgot to mention an important aspect of the staffing rotation will include New York State certified peers, peers for the mental health side and peers for the substance use disorder side. As far as the nurse, if we did have that situation, we would find coverage for that particular shift, whether it was through overtime or through per diem staff that we will have available in such a situation. But if we do partner with the healthcare system, it should reduce the potential for a call out or for a resignation or any type of unexpected circumstance, because we'd have a base to work from for coverage. We also have a situation internally with MHAST. We have a 24/7 crisis respite house. And if we do have a call in, we have staff that flex around their schedules. They do partial shifts. So we have experience making sure that we can operate a 24/7 program.
Are there any other questions, comments, concerns from the commissioners? Okay. Any other further deliberations before we move on to a final deliberation and a final decision on this project? Okay. Tito, what am I looking for as far as a motion?
A motion that the requirements for site plan review have or have not been met.
Okay.
And
That's why I read off that long checklist.
no, so this is a
No.
type 2 action, so
Oh,
we don't
okay.
need to go through that. So it's
Okay.
just a motion that the requirements for site plan review and a special use permit have been met or have not been met. So either to approve or deny.
Okay.
I just asked that if you vote to approve, that it be subject to the installation of a compliant concrete apron onto Shenango Street.
Okay. Fair enough. All right. So at this point, I would entertain a motion to, well, I wish I had written all that down, Tito. To approve the site plan and special use permit for this application contingent upon the concrete apron being planning approved. And we'll let Shaylin clean that up in the minutes. Do I see a motion for that?
I'll make a motion.
Okay. Is there a second for that motion? Okay. All in favor of approving the application for site plan review and special use permit pending the concrete apron improvements? Raise your hands and say aye.
Aye.
Aye. Any opposed for nay? Okay, 5-0. It is approved. Okay, we're gonna move on to our next public hearing. At this point, I would call forward the folks from Centerline Communications LLC, project address 30 Brown Street. Okay, good evening. So just to reiterate this, so this is gonna be the second time you guys are coming back. If I could have you two both identify yourselves, name and address, and then give any specific updates, which I do remember there were some things we asked you to make some changes, alterations, and clarifications on for this upcoming meeting. So go ahead.
Absolutely. So I'll start off with an introduction. My name is Jeff Twitty. I'm an attorney with Nixon Peabody here tonight on behalf of City Switch and AT&T. Business address 1300 Clinton Square, Rochester, New York.
My name is Brenda Blask-Lewis. I'm a site acquisition consultant with Centerline Communications. I'm also working with AT&T on this project, 763 Eatonville Road, Herkimer, New York.
So just to give a recap of what we're looking for from this commission, we're proposing a 110-foot monopole at 30 Brown Street on a 70 by 70 area, right-of-way area leased from Norfolk Southern Railway. The tower itself will be of a monopole design, 110 feet, 120 feet with a 10-foot lightning rod, and we're looking for a tower special permit and site plan approval. We sent on April 1st, yesterday, a supplement to our initial application addressing some of the questions and concerns that this commission had at last month's meeting. Notably, this supplement to the application included revised propagation studies showing what coverage would look like if the tower were to be 59 feet, which is, I think that's the distance to the nearest setback and would be in turn the maximum height for this tower without a variance. So we show what it would look like at 59 feet versus the proposed 110 feet. We have photo simulations of the site, including one photo simulation showing what the site would look like when viewed from 17C. I believe the photo in the photo simulation package that we sent to you all views the tower along 17C coming east from, it looks like, the Johnson City Bridge or the arch. And we also revised the site plan to include the proposed asphalt drive to replace our proposed gravel drive, as well as evergreen trees along the western side of the compound. So we're happy to answer any questions.
Are there any questions from the commissioners before we open the public hearing? Okay. Seeing none, I'll have you guys step away and we'll open the public hearing. Okay, so this is now the public hearing for Centerline Communications with a project address of 30 Brown Street. If there are any members of the public who'd like to speak, you may now step forward to the microphone, and we ask that you keep your comments to 5 minutes.
Is this on?
What's visibly green and speak right into it.
Okay. My name is William Smith. I own the property at 40 Brown Street. And that's right up close. First of all, I didn't even know there was a 30 Brown Street. I mean, we go on the internet all the time to look at the things and what the property, who's got what property, and there's nothing there about a 30 Brown Street. So I know at one time there was a right of way through there. The rail yard went over to service all around builder supply. But anyway, but they just mentioned about this new one and making the tower shorter or something. And I hadn't seen anything on that. I came down here last week, got some pictures of what was proposed. But there was nothing in there showing about planting trees. I have large tractor trailers in there weekly, sometimes daily, that have to back up to a door right at the end of there. My asphalt's a little bit, it doesn't go quite enough. I should have gone more, but I've probably footaged out. But these are big trucks, 53-foot tractor trailers with sleeper cabs. If you go putting trees in there or something, I'm not going to be able to get these big rigs in there. I also load flatbeds down on the side of the building, but that doesn't fall into this. But I'm really concerned about planting trees there because it'll just block off everything. I won't have full access to that back door. That's That's a problem. I just don't think it's a really good fit. Putting a tower there when there's other places probably even on the street that would be a lot easier and it's ground ready. But that'll probably be, you'll probably hear that from the next person. That's it.
Thank you. Is there anybody else who'd like to speak on this public hearing? Yes, come on down.
Good evening, everyone. My name is Jim Spear. I own a lot of property on Brown Street, all around where this proposed tower is going up. Is it still proposed for 110 feet tall tower? Currently, okay. So they have a property, there's a right of way, which is a right of way to my property that's been there and it's been in effect ever since I've owned the property in 1985. And I have a map of the right of way and the height of the tower, if it were ever to topple, will hit 3 of my properties and Bill Smith's property next door to us. You can't put 10-foot tower up in a 66 or 77-foot wide space. I mean, if you can't contain your own tower in the property lines, I mean, it makes no sense at all. It's a danger to the whole neighborhood. I see there's a lot of other blocks on, there's other rental sites or whatever proposed additional pads for who knows what. There's a lady on the corner, her name is Lucy. She came to me with problems that she has a heart defibrillator or a pacemaker, and she's concerned with all the electric, that may be added onto this pad. We just had Brown Street repaved a few years ago. Then the year after they paved it, they come through and they dig it all up for sewers. Now we got it repaved again, and now these guys want to do underground electric to their pad. They're asking for on 110-foot variance or a offset, they're asking for 59 feet. That's like ignoring the setback requirements. It's half of it. It's not like, hey, it's 10 feet off, 5 feet off. It's half of the distance of what your normal setbacks are. So this is not a good fit. There's plenty of tall buildings. There's plenty of cell service with AT&T all over our neighborhood. I don't know why they're actually putting up a tower when we have full coverage in downtown Binghamton. If they're just another corporation looking to get off leasing other towers from other companies, so they're by our doing a bad deed to our neighborhood, they're just trying to get more money because there's perfect cell service in our area. We just had the Ansco Camera Factory, a blight that was just rebuilt and is beautiful. They just put that up. It is one parcel away from that new building where they're going to see the tower. Like I said, we just been cleaning up the neighborhood. Bill just did brand new blacktopping for his access for his tractor trailers. We have that area down there has been used as staging area by Vector, who's doing all the bridge projects, which they're coming back again this year to do the bridge project. And they've used that property down there for a way station to get rid of the property or to get rid of the disposal from the bridge projects where they rip up all the concrete. Dan Hartman is actually contracted to them to take the stuff away. Denise Construction uses it down there. It's been a good thing for the community to let it be a construction area where we've been able to help the city of Binghamton's used it when they're doing paving contracts. They park their vehicles there. And this is actually a right of way in my deed that the railroad track goes, the right of way goes right through this void right here. And it's a right of way to my property. Right now, I don't use the train system, but who knows, 10 years from now, maybe the train system will be advantageous to come to my property. I have a huge property across the street. I'll hand this map around and show you where the tower is going to gonna affect. This is the first we've heard of, as a public of, them doing this. So anyway, it greatly affects my property and it's a danger to all my properties, at least 3 out of the 4 that are in that neighborhood. So
Tito, before I got a question for the speaker here, because I see there's some color coding on this map. So just so when we're looking at this map here in a few minutes, it's passing around.
The red portions are my properties. The blue building is Bill's property, and the circle is where the tower would fall.
And to help educate us, remind me, who's Bill? Bill's the first speaker,
First
okay?
Who owns the property to the west.
And there's also a circle I see drawn on there.
That's if a tower comes down, a 110-foot tower.
Okay,
In a 77-foot spot.
thank you. Time, are we close to the 5-minute mark? Okay.
I'll hold.
Okay, while we're looking at the map, I'll ask, sir, if you don't mind stepping aside, we'll open up the public hearing to whoever's next in line.
Just for my last 30 seconds, I mean, like I said, it is, it's crazy to have them not self-contained in that area for a 110-foot tower and a small space.
Okay. Thank you. Is there anybody else who'd like to speak on this project at 30 Brown Street? Going once? Oh, okay, sir?
How you doing today, ladies and gentlemen? My name is.
You can have you just lean in and make sure the green light is on the microphone.
My name is Dan Harbin. I'm owner of Harbin Enterprises. I currently use the property some here and there to stockpile materials, like we just helped out with the Glenwood Ave bridge rebuild, reconstruction, which most of it is on Jim's property, but Jim has a right of way that goes across the area that they're proposing this tower site to go on. And, I don't think it's a good fit for the neighborhood. And, I think it'd be best fit for somewhere else, really.
Yes, just to clarify for the public record, what is this bridge contract you're working on? Let's pretend I don't know anything about this bridge contract. What is this bridge contract you were working on for the city?
It was for Vector Construction. We were just helping them out, stockpiling materials there, utilizing some of the property to basically stockpile materials, haul it away when necessary, for the Glenwood Ave, Railroad Bridge project.
The property, you mean you're stockpiling materials at the 30 Brown Street lot?
Yes.
Okay.
Yes. Yep. Yes, we were stockpiling some materials there, correct. Yep. So it's gonna be used again, more than likely this summer for another railroad bridge project in Binghamton and Johnson City, Leicester Ave. We're gonna be doing some trucking and whatnot for them as well. But yeah, I just don't think it's a good fit, that big of a tower in that area. And not to mention the vagrants and stuff like that, in the area, it'd be a danger having people climbing it and everything else if they got in there. So. That's about all I got.
Thank you very much.
Yep.
Is there anybody else who wishes to speak tonight on this public hearing for 30 Brown Street? Going once. Going twice. Gone. Okay. The public hearing on 30 Brown Street is closed. I will call the applicant back up to the mic. And we'll first allow you guys to address various questions and concerns that were brought up during the public hearing before the commissioners ask you a battery of questions.
Absolutely. So it sounds like the most concerning aspect of the project that was brought up was the fall zone and where exactly, in the case of a failure, which is unlikely for a tower like this, where it would fall. When the fall zone extends into adjacent parcels, as the fall zone for this tower does, there's a breakpoint that's installed in the tower itself to make sure that it does not fall onto any of these adjacent properties and that it would be contained entirely within the 30 Brown Street site. So, we wouldn't really be running into issues of, a tower, a full 110-foot tower collapsing onto a neighbor's property.
Can you, for the record, and for those in the audience, what is the height of the break point?
It's the midpoint of the tower.
So 55 feet, if I can do that math in my head. Okay. Okay. Do you have anything else you'd like to bring up before I turn it over to commissioners to ask questions? Okay. I'll open up to commissioners for questions, comments.
Chris, I just want to know really quickly, we did get a letter in opposition from Linda Willerton.
I did see that on Basecamp. So yes, that's also on record. Kyle, did I see you? I'm just gonna have you lean right into the microphone.
I'm not an engineer, but I know that when they designed the tower and, we'll be requesting a variance for the setbacks, but the way that the tower would be designed is to have it in the event of a failure, it would be basically falling on itself. So instead of falling 110 feet, it'd fall like 55 feet, which would be within the fall zone. Oh, sorry about that. Correct. Correct.
Just asking if everybody can be louder so they can hear in the
Okay.
back.
Sorry about that.
Okay. Repeat
Okay, all right.
more loudly.
As far as the break point in a tower, the tower would be designed so that in the unlikely event that it ever failed, it would fall midway. So instead of falling 110 feet, it would fall at 55. And we have an engineer's letter that we provided you guys with that's, it says that the tower will be designed with the break point.
Sir, I'm just gonna say the public hearing is complete. At this point, the applicants are speaking with the commissioners. So just like the gentleman from the previous public hearing, you're welcome to stay as an audience member and listen to the discussion. But at this point, the public hearing is closed. Yes, Kelly, go ahead.
So in that aspect of, to address the fall, I know that there is a letter there, but it would be a lot more helpful to see an engineer's drawing that can give us more proof of this. And there's been some debate about maybe property lines and where we have access points to this. I wasn't here before, so I don't mean to step into something that I missed some of, but that seems to be, is there something more clear that we can define if we do have problems with any of these access points and how this would affect people's doing business as they have? Are these questions I can, you can help me ask, Tito? Sorry.
I was actually looking at the plans, so
Yeah.
I did not get any of that.
Sorry about that. Yeah, asking about this, about the questions that have been identified about people's access and their ability to do their current business.
Yeah.
And have we looked and identified that the property lines, what's with this, and seeing an architect drawing of how anything would actually be with this breakpoint to make sure.
Tito, to follow
Some
up,
of
one
these.
question I had. So one of the speakers, I believe it was Bill, addressed the concern about the evergreen screening
Yeah.
that was listed in the staff report.
Yeah.
And if evergreen screening is implemented by the applicant, would it block his access for his tractor trailers to access 40 Brown Street.
That's
So
what I was
can
getting at.
you speak to what you're looking for
Yeah.
as a planning commission, as a planning department, as the evergreen screening?
Sure.
And how it would or would not block access to Bill's trucks at 40 Brown?
So I'm looking at 40 Brown Street on our mapping system. Mr. Smith should be able to access his property without having to cross over someone else's property, and it looks like he should be able to do that. I don't know if he saw the site plan where the evergreen shrubs are proposed, but they're on that railroad right of way. They would not be on his property. So they shouldn't block access to his property. If he's accessing his property from Brown Street via a curb cut onto his property, then, those shrubs wouldn't be in that vicinity. They would be only on the railroad property. As far as the break point in the pole, I think what the commissioners would like to see is that shown on the elevation of the tower. An actual height noted on there and shown on the elevation of the pole. And then as far as the other uses of the property, it's railroad property. And if they have a deal with a certain business to do or have had a deal in the past to do business with some of the former speakers, and they've decided to no longer do that and instead do business with AT&T, that's really up to them. As far as the easement, I don't know if it's a formal easement that Mr. Smith was referring to. We didn't know about that. If there is an easement, a permanent easement that has to be maintained, then it has to be maintained, and they wouldn't be able to build this tower in a way that obstructs that.
So I have a question based on a couple of comments that were raised during the public hearing. So I understand that you are not the attorney for the railroad. You're the attorney for we'll call it the cell phone tower that wants to rent the site.
Correct. And
Okay.
AT&T as well.
So, but can you speak to what the construction process will be like, and will it potentially prevent somebody else from storing and stockpiling bridge rehabilitation materials if other people previously have been using the site at 30 Brown to, if I understood correctly from the public hearing, stockpiling bridge rehab materials for ongoing construction projects?
Sure. I mean, my high level understanding of how these sites are typically constructed is, it's depending on the availability of utilities and materials. It takes about 1 to 3 months to put one of these sites up. But I mean, as far as, the already existing uses on the site, I don't know how that would really work there.
I think the issue is do the people that are using the property, it's railroad right of way property, do they have permission from the railroad to use the property? So, I mean, and we can't say, okay, once the tower is up, all, prior uses can continue because it's a railroad property. So it's really hard for us to speak to that.
But the road in still has businesses that are not owned by the railroad that,
Correct.
what's the impact for those businesses? That's also the question, not just on the railroad, but these are, working people who really have relied on this for, 25 years.
Well, once the site is built, the only time anybody would be, accessing it is for maintenance, maybe once a month or once every 2 months.
What happens possibly in 3 months, they might have, quite a bit of difficulty getting in and out of their businesses?
And I would think that the general contractor who's building the site would have to get the proper permits, if they have to block the road for whatever, if they've got concrete trucks or something coming in, but it wouldn't be a long-term disruption.
I'm going to opine off record, but I'm wondering if the people who have been using this site for storing of their bridge construction materials, you may need to revisit your lease agreement with the railroad. I'm just wondering that out loud. Question, without having the schematics pulled in front of me, what is the, I guess, maybe final footprint of the tower compared to the full lot size at 30 Brown Street? This is like a 10 by 10 foot thing, or?
I mean, the lease area itself is 70 by 70. So, we'd be contained within a compound in that lease area. So it looks like, yeah, to be safe, I'd say the 70 by 70 lease area. That's where we'd be. And I think the total amount of disturbance on the site itself is under a quarter an acre, maybe 0.23 acres.
Yes, Joe, go ahead.
Chris, would it, or in group, would it be a possibility to look into who actually owns that piece of land from the city's perspective? If it's railroad or if there's, if it's owned by, it's in deeds of the people that spoke tonight. And what I'm thinking is if we voted on something that the ownership is not clear, this is not a case of someone building a porch on their house because there's a third party of land involved. What do the deeds say? Is it worth a quick look at that? Or say if we approve or disapprove it, subject to a review of that by other parties? Someone should look into what rights are involved in the property.
So I'll jump in a little bit here. I mean, from the city's perspective, we're not gonna go in and look and see who has control or not and make that determination. Now, we could ask the applicant to provide some sort of proof of site control in the form of a lease or something, and to the extent that, the applicant and other owners in the area might have conflicting rights, that's really something that they're gonna have to work out, and the city's has no business getting involved in determining who has what rights to this piece of property. But we can ask for some sort of evidence that, they have the right to use this property for the antenna they're proposing to go up.
And just to jump in, we
Yeah.
provided that in our initial application as Exhibit J. It's a lease between Norfolk Southern Railway Company and City Switch.
And our vote to say subject to evidence provided by the applicants.
Well, and again, going off what the applicant's attorney just said, we did get a signed lease between the applicant and Norfolk Southern saying that they have the right to go in and do this. Again, to the extent that there's some sort of issue between the railroad and any other person that has either lease rights or easement rights, that's something that they're gonna have to work out.
Are there any other questions or comments from the commissioners?
Just on the breakpoint or lack of a breakpoint, I mean, would the applicant be comfortable if this commission granted something that was within the current zoning ordinance, so it would not extend the fall radius? So the fall radius would not extend into the nearest property at all, with or without a breakpoint?
Absolutely. I think that's fair. And I understand that, radius that we're limited to be 59 feet. So if the estimated breakpoint here is 55, we should be able to meet that comfortably.
And then with the staff comments and findings and the updated report, has the applicant been briefed on the last two conditions with the antenna being operated at the FCC designated frequencies? Was that in the original or was that in addition?
Oh, that's in the updated staff report.
Do we need to go over that, acting president, or?
If you could please notify the applicant of what those conditions are. Those come directly from the code,
Okay.
or I can read them too.
Why don't you read it if you have it handy?
Let me pull it up.
Or I can get us started with at least one of them. One of the conditions is that and to the applicant is that the communications antenna will be operated only at the Federal Communication Commission designated frequencies and power levels and/or Environmental Protection Agency technical exposure limits, and may periodically require that the applicant provide competent documentation to support that maximum allowable frequencies, power levels, and exposure limits for radiation will not be exceeded. The second requirement would be Unless otherwise preempted by federal or state law, the telecommunications facility shall be inspected every 2 years at the applicant's expense for radio emissions, and a copy of the report shall be promptly delivered to the building inspector. A licensed professional engineer specializing in electrical engineering with expertise in radio communications facilities shall perform radio emission inspections. The radio emission inspection shall describe the power density levels of the electromagnetic energy generated from the facility, including the cumulative effects of co-located antennas. In the event that the radio emission inspection indicates that the electromagnetic energy generated from the facility is above the allowable limits stated with applicable FCC or ANSI standards or other applicable federal or state guidelines in effect at the time of the inspection, the applicant shall cease all use of the facility until such time as it proves to the satisfaction of the building inspector or pertinent city consultant that the power density levels of the electromagnetic energy to be generated at the facility are below the applicable standards. We headed home now. Thank you.
Are you guys okay with those two conditions?
We are, and we have a, documentation from the engineer, our RF engineer for the site that, as it is proposed now, we are well within those electromagnetic energy or RF limits for the site. So that shouldn't be a problem having that inspected every 2 years.
If I don't see any other questions or comments from our commissioners, looks like we're ready to move on to a motion to approve the site plan and special use permit.
You need to go through SEQR first for this one, because this one is an unlisted action.
Oh, okay. All right. So I will make a motion that the planning commission is the lead agency for SEQR determination.
Second.
Okay, that's a second. All those in favor say aye. Aye, it's 5-0. All right, and then as far as the SEQR determination, I'm going to make a motion, bear with me on all this, that the type of action will be unlisted. Tito, jump in if I make any mistakes here. And the following things are included. Will the proposed action create a material conflict with an adopted land use and or zoning regulations? No or small impact. Will the proposed action result in a change in the use or intensity of land use? No or small impact. Will the proposed action impair the character or quality of the existing community? I'm not seeing a check mark there, so I don't know what that means.
That means there should be some discussion on that.
Okay.
These are all recommendations. Your finding can be different for each of these items.
Okay.
The ones that we left blank, we thought there should be some additional discussion.
Okay. Will the proposed action have an impact on the environmental characteristics that cause the establishment of critical environmental area, CEA? No or small impact. Will the proposed action result in the adverse change in the existing level of traffic or affect existing infrastructure for mass transit, biking, or walkway? No or small impact. Will the proposed action cause an increase in the use of energy and it fails to incorporate reasonably available energy conservation or renewable energy opportunities? No or small impact. Will the proposed action impact existing public and private water supplies and or public-private wastewater treatment utilities? No or small impact. Will the proposed action impair the character or quality of important historic, archaeological, architectural, or aesthetic resources? No or small impact. Will the proposed action result in an adverse change to natural resources, wetlands, water bodies, groundwater, air quality, flora, or fauna? No or small impact. Will the proposed action result in an increase in the potential for erosion, flooding, or drainage problems? No or small impact. And the last topic, will the proposed action create a hazard to environmental resources or human health? Which I think we have discussed that with some of the radiation issues and the like. So I've made a motion for all those things and the type of action that being enlisted. Do I see a second for my motion out there?
Chris, before you jump to
go ahead.
that, are we saying that for all of them, there's no small impact, including the ones discussed, just to clarify?
Yes, that's my motion. They're all no or small impacts. Is there a second to my motion? Otherwise, it might
Yes.
fail.
I'll second it.
Okay, so there's a motion and a second. All those in favor of approving this unlisted type of action? Wait, Tito, jump in.
So, the next vote will be that, you know, based on your findings that there were no or small impact for all these items, that you issue a negative declaration.
Oh, so we're
under
actually issuing,
SEQR.
okay. So we're issuing a negative declaration because of all these no or small impacts. Okay, and there's a motion, and there's a second from Manny. All those in favor of a negative declaration, say aye.
Aye.
Aye. Joe, you're hesitant? Okay, so it's 5-0 for a negative declaration. Okay, so what's the next motion we would be making in this process, Tito?
The next motion would be, a finding that this, requirements for a site plan review, special use permit and tower special use permit have been met or not.
Okay,
Then I ask that if you find that the requirements for site plan approval and a tower special use permit have been met, and you vote to approve this, that it be subject to the granting of the variance for height by the
Okay.
zoning board of appeals.
so I would entertain a motion to approve the site plan and special use permit for the tower contingent upon zoning board approval of the variance. Someone would like to make such a motion?
That include us getting something about the break point in there? I'm sorry to ask that.
That's fair.
So that's up to you. You could either, make a decision subject to that being submitted to the planning department, or you could table it and wait to make a decision until you see it yourselves.
What's your preference, Kelly?
I'd like to see it on a drawing,
Okay.
but I don't know how everybody else feels.
Tonight, I'd be okay with voting on a 59-foot, but not a 110 with a variance without seeing anything else.
Okay. So what you're looking then to vote pending a 55-foot break?
No, just a 59-foot tower.
Oh, just a 59-foot tower. Okay. Okay. So I'll someone make a motion and we'll entertain that.
Okay, I'll make a motion to approve this special use permit pending a 59-foot tower, right?
just a-
Or-
Okay, go ahead.
Just a
Corporation
thought
Counsel.
here
Sure.
Was that, does the applicant want the opportunity to come back and present their break point rather than having you guys vote on something they might not want, which would be the
Okay.
59-foot tower?
Right, so we need the 110 feet. So, we can get something, I'm not sure exactly what more we could show in addition to the stamped engineer's letter that discusses the breakpoint. We could certainly put together an elevation showing where the breakpoint would be located. I don't know if it would also be helpful to have an elevation showing what the tower would look like collapsed on the breakpoint. But I think that the structural letter, again, signed and stamped by an engineer, saying that there will be a breakpoint that will keep us within the parcel, would be the strongest piece of evidence here that the breakpoint would be included.
And I mean, I'm not sure how many commissioners would be in attendance, next month if we did want to table it for a month, but I would probably be most comfortable with the 59-foot tower period, and that would be it in deference to the neighbors' concerns.
Okay, so the applicant makes it sound, correct me if I'm wrong, you want 110 or nothing. Am I understanding that correctly?
Correct.
59 doesn't work.
It doesn't work.
Okay,
Okay.
so
Then-
at this point, I think the three options are we approve 110 right now. We table this to next month if we want to see other documents like drawings and letters about the 55-foot break point. Or I guess the third option, we just deny the whole thing.
Apologies. I'm either with with him, or we table it and see what the other commissioners have to say with some more drawings, but I'm not
Sound-
going through for now.
Sounds like the best chance of this project going forward is if we table it.
Because today I think we won't get a vote for it. Well, I mean, possibly so.
Well, how about this? I will entertain a motion to table this till next month to allow for further things to be submitted. So Kelly's making the motion. I see Manny seconding the motion to table. Before we take that, though, let me just ask, do we need to reopen a public hearing and schedule a public hearing for next month if there's yet more documentation?
Yeah, if they submit more documents into the record, we'd have to reopen the public hearing.
Okay.
And then the other thing is that I just asked that the commission be specific about what you want them to bring to the next meeting. Is it just an elevation that shows the proposed breakpoint? Or do you want more things in addition to that?
The proposed breakpoint and the fall zone, if they could do, and what the tower looks like up and intact with those fall zone points.
Okay.
May I add what triggers the break? 90-mile-an-hour wind, 100-mile-an-hour wind?
110
What
miles an hour.
triggers?
110 miles per hour.
Thank you.
Manny, any specific things that you'd like them to produce? Okay. Kyle?
Mentioned.
Okay. So at this point, I will entertain a motion to table this project to next month with a new public hearing next month, pending the applicant submitting the documentation that Kelly mentioned, sort of diagramming the breakpoint and how it would fall.
Okay.
So I'll make a motion on that. Kelly, you'll second my motion. All those in favor of that tabling and public hearing and document request for next month? 5-0. Okay. We'll see everybody in May.
Thank you. And not related to this board, I guess this would be more of a staff question for the zoning board. Would this keep us, I know there was just SEQR, so would we still be able to get the height variance next week, or would that be pushed off as well?
No, they're doing uncoordinated review, so the ZBA should be able to make a decision if they think it's appropriate next week.
Okay, thank you.
Yep.
Okay. Our next public hearing tonight is Bramberg, and the project address is 348 Clinton Street. Come on down.
Good evening.
Okay, so if you could again, we'll start off with if you two could each identify yourselves, name and address, and give a brief update on any changes since last month, because we're probably mostly focused on human service and cell towers and human services building. We may have forgotten all the details of your project.
All right. Well, there's no cell towers. I'm Paul Deely. I'm an architect for the project. My address, 709 Conklin Road in Binghamton, New York, 13903.
Greetings, and I am Bram Berg. I am a manager of Binghamton 346-348 Clinton LLC, which is the applicant in this process. And in this proposal, we're addressing some of the need for housing in the area of the First Ward, particularly on Clinton Street, as well as the dearth of commercial retail space that has been largely unoccupied. And our plan for this one and then a subsequent presentation are to allow for a housing unit in the back and a modern unit in the front. So basically, we are abiding by a 30-foot setback. Oh, sorry, this is regarding 348 Clinton Street in Binghamton. It's called the Clinton Commons. The property is currently a vacant building. There's a commercial store and then there's a apartment upstairs, but the spaces that are being mentioned have been fire damaged, vacant, that's mostly used as storage. So we're trying to bring that into use as an apartment, and I'll let Paul do the rest of the presentation.
All right, thank you. There's no changes from our last review of the first review. So are there any questions? Do I need to explain the project?
At this point, I'll defer to the commissioners. Do any of you have any questions for the applicant before we open the public hearing? I have a sneaking suspicion this may not be as controversial as the last two projects, but we'll see. Any questions?
I'm good.
Okay. Why don't I have you two take a quick step back and we'll officially open the public hearing. So this is the public hearing for the applicant Bramberg and the street address being 348 Clinton Street. If there's anybody who'd like to speak at this public hearing for this project, now is your chance to step forward. Going once, going twice, gone. Okay, come back on up. The public hearing is officially closed. Okay. Again, does anybody have any questions or comments? I don't remember this being very complicated or a lot of questions from last month, but we will see if anybody's got anything else. Anybody discussion at all? We'll be possibly move on just to whatever the next motions will be. Okay, so this is a type 2 SEQR review, so no further environmental review is required. I'm gonna make a motion for that.
That was done at the last meeting.
Okay.
Doesn't hurt to do it again, but you don't
Okay.
have to.
Okay, if I don't need to make more motions, then we don't need to. Let's not. So next we're moving on to the approval of the site plan, and is there also a special use permit here?
Yes.
Okay, so I'll make a motion to approve the site plan and special use permits for this project at 348 Clinton Street.
I'll second that.
Okay, second by Manny. All those in favor say aye.
Aye.
Aye. 5-0. Do we need to do any other motions? Congratulations, you're in and out. But don't go too far because I think you're up again next.
All right, so this property is.
Oh, wait, let's officially call this thing to order. So the next thing on the agenda is again applicant Bramberg, and this is for 299.5 Clinton Street. Okay, go ahead.
Okay. So this is a similar property on Clinton Street, a storefront, currently vacant. The first floor has a storefront and the rear of the property is part of that. And we wish to divide it and make it into an apartment with a commercial space in front. The previous review asked that we change the gravel parking area in the rear of the property to a paved area, which we've done. Tito, I emailed you that earlier today.
Yep, I uploaded that on Basecamp, but I just want to clarify that point. There was a new paved area that was proposed as gravel. They've changed that to asphalt, so that's good. But part of the staff comment was also that all paved areas should be repaved because the existing driveway is pretty much gravel right now. So
Sure.
new and old should be paved with asphalt.
Does the applicant agree to paving all those surfaces?
Do I answer that or?
Yeah, so initially to get this going, we were gonna just patch for the time being, anything that was issued and that the new part would be paved, if that makes sense.
Are there any other questions from the commissioners before we open up the public hearing on this project? Okay, I'll have you guys just take 2 steps back. Again, I don't expect this to be very controversial, but we'll see if we've got a lot of people that are ready to speak on this. All right, so I'm going to be opening the public hearing for the applicant Bramberg, the project address 299.5 Clinton Street. Is there anybody here tonight who'd like to speak on this project? Going once, going twice, gone. Come on back. All right. So anybody else have any other last minute questions, comments before we move on to potential motions? Manny?
Nope, just the, as long as the applicant agrees to pave all the surfaces after
Okay.
this, then we should be good.
Tito, would it be appropriate for us to include in our approval of the site plan and special use permit contingent upon the proper paving that meets planning department requirements?
Yeah, contingent upon resurfacing of all driveways. And I just want to note that just the condition of that driveway off of Clinton Street is not really patchable. If you recall at the last meeting, Nick thought that there was landscaping there against the fence because it's basically overgrown and it's not something.
So it
that
looks
can be
like patching
patched.
will not be good enough for that old spot.
Well, Nick, who's not Mr. Corcoran, that's not here at the moment, he did mention that there was landscaping on the south side that's along the property border that's fenced. No, he's right, that is grass. All right, so to be clear, the driveway, in my opinion, isn't gravel. I think it could be what's it, sealed, if that would be acceptable in the grass area. We want to make it right, but we don't want to do extensive work that's not necessary. So if it's the board's opinion that it's necessary, then we'll carry that out. Additionally, Tito, if I could ask you, we show 8 parking spaces. Have you determined what the minimum parking? What we did is we determined what the maximum would be. So for example, if we didn't have to pave the rear area and have 2 less parking spaces, thus go from 8 to 6, then we could probably pave the existing area or bring it up to the DOT standards for a parking area.
So the staff report notes that the changes you're proposing would require 1 space and 8 total are shown. So
Well, the existing use, there's still existing use of
so
the site.
the commercial use does not require parking. It's an
Alright.
existing building. That commercial use does not require parking. The existing house in the rear needs 1 space, and then the proposed new unit would need 1 space. So that's 2.
And then the second floor has apartments, 2 apartments.
Those would each need 1.
All right,
So that's
a
4.
total of 4.
Right.
So I propose that we eliminate the new parking space, the one that I changed prior to the former meeting, and resurface the existing lot as it is now.
So it would be up to the planning commission if you're comfortable making a decision subject to the site plan being revised to remove the proposed new parking space and to note that the remaining parking areas and driveways will be resurfaced.
What that would do would allow the rear house to have more yard or patio, which it has now.
Okay, so what will you be doing with that gravel / broken asphalt that would now be excluded from parking? You're gonna tear that up and put sod in? I think the goal is we don't want that broken up gravel, and regardless of whether you're calling it parking or a patio or, you know, Fido's walkway, we don't want it as is, sort of gravelly, sort of broken asphalt.
You're talking about the existing drive or what we were proposing as new asphalt. I'm not clear. So the existing drive, we would resurface. I don't know if that's clear enough. That to me is milling out the existing 2 or 3 inches, leaving the existing base and putting a new topping on, which is typically a 2-inch finish. Where we had 2 new cars on new asphalt per the drawing, currently is a lawn with a partial brick paver that the rear address used as a patio, we would leave that as is. Do you have the picture in front of you, the actual photograph?
I won't lie to you. Well, I'm trying to make heads or tails of these 45 very bad photos. I'll let others, what are your thoughts here on my fellow commissioners?
So is this what we're looking at?
Correct. So you'll see the white roof, that's the front building that faces the street. The tan
Sure, this is
roof
the house.
is the rear. Directly in back of that, you'll see lawn, green lawn with a existing garage on the bottom of the page.
And you had planned on paving this area.
Correct, to allow for 2 additional parking spaces, which Tito has told us isn't required. We were just trying to maximize parking to show that that's what could be there. Typically, parking is a point of contention.
It is. So you would remill and pave this bit here.
Correct. From
So the
the
length.
existing drive at the street back toward the garage, which is part of the parking.
I'm okay with that as long as that lawn area doesn't become parking. And I'm not sure, you know, if it's not in the plans, it's not in the plans, but
Right.
I'm not sure if there's much we can do.
And just to clarify, so I'm getting, looking at your previously submitted plans, it's what's labeled, I guess, spaces 3 and 4.
Yeah.
Let's put some numbers on this. So 3 and 4 going to remain lawn
And it will not be used for
and
parking.
brick pavers. Okay. But you are going to repave. I think what we're mostly concerned about, you're committing to pave with nice, new, beautiful asphalt, slots 6, 7, and 8. I think that's where a lot of us are like, that's looking pretty junky. That's a technical term, junky.
No.
Yeah, I can't speak to the landscaping, but from here, it just looks like overgrown weeds and,
Yeah.
and grass.
All right, not to push the envelope, but if I only need 4 spaces, can I just abandon the garage and make that lawn or not improve that driveway? Can I cut my driveway cost in half? I don't make the
I'm
rules,
not sure
I
if I
just play
understand
the
this.
game.
I understood losing 3 and 4. I don't understand your current next proposal.
It would be 5, 6, 7, 8 solely.
So if I
What?
just give my opinion, I understand what he's trying to say, but I would suggest that if you find that, if you think that might be acceptable, I think you should probably table and get a revised site plan, because it's a pretty big departure from what's been presented.
All right,
It still
just
is the
as a, give me a moment, please. You won't delay opportunity cost, you want to delay this another month, or do you want to pay?
Can we just do a conditional approval if we just?
Manny, what are you saying?
They can visualize that.
They want us to resubmit.
Yeah,
Can we just ask for a conditional approval?
Sure.
no,
Okay, can we ask for conditional approval for what we just described, paving from parking space 5 forward to the street as new paving?
And so I make sure I understand this, because I don't mean to sound silly, but there have been
No,
like
let's-
14,
let's be
there've been like
clear.
14 different suggestions now. So the gray shaded area, parking lots 3 and 4, will now remain a lawn
Correct.
or pavers. You're going to pave, we'll describe it from parking spot 5 to the street, which covers 5, 6, 7, and 8. So what's going to happen for the broken up asphalt and gravel and not very pleasant looking material from 5 back to the garage? What's going to happen with that?
It's
Part of
going
that.
to add character to the site.
I think the short answer is I don't know if we're going to find that acceptable.
Right.
I mean, if you're going to tell us you're going to resod that, I think the goal is we don't want, if you're coming for us there's gotta be some sort of fix for this broken asphalt from 5 back. Am I the only one who feels that way?
No, that's where I'm at too.
Yes.
From
I
the,
don't
say
think,
that this
and
is
I
a-
don't want to sound like,
Street.
let's make a deal here, but at some point, we have other applicants. We can't
Yeah.
negotiate. That's not really the
This is
appropriate
a
thing to do
very,
here.
not regularly used, part of the, or a visible area of the site in general. It's a very long lot, but maybe we could do like permeable, pavement or something.
It's gotta be rewritten, submitted then. I mean.
Yeah. I think at this point, I'm leaning towards making a motion to, the motion table and allow the applicant to potentially submit a revised site plan for us to review. And if I make a recommendation, have it be one site plan, not a menu of 3 options. Now, you and your architects and engineers and attorneys can figure out what you want to submit. But I think you've got some feedback tonight that we're not very receptive to leaving large chunks of broken asphalt and gravel behind spot 5. And don't try to negotiate that with us. That's not gonna fly. So I will entertain a motion to table this to the May meeting to allow the applicant to submit a revised site plan. If there's such a motion.
yeah, I'll make a motion.
Okay, there's a motion and I see a second from Kyle. All those in favor of tabling this till May?
Before you. We acquiesce. We'll pave everything.
Is that including 3 and 4?
Negative, just the existing drive, 3 and 4 are as they are now.
But you'll clean that up, so there's no brush back there.
Oh, it actually looks nice right now.
I would
All right,
be-
well, let's do this. To make sure it's clean for the minutes. There was a motion and a second to table. I'm gonna recommend if people want to proceed with this most recent 11th hour suggestion, we vote down the motion to table. So all those in favor of the motion to table, Joe, go ahead and question before I call a vote. Go ahead. What's your question? No, this drawing is well out of date, about half an hour ago.
So one option might be that you could approve it contingent upon them submitting an updated site plan to Tito showing 3 and 4 staying as they are. And basically give Tito the discretion to say, yes, this is acceptable, we can move forward.
Okay.
So that we get the site plan we want and we can get the approval done tonight.
That's fine. Okay, so let's first, for procedural clarity, there's sadly still a motion to table on the floor, which I think we need to now vote down.
Mhm.
So all those in favor of the motion to table the applicant till May, say aye. All those opposed to tabling, say nay.
Nay.
Nay. All right, the motion to table fails 5-0. So now there looks like there may be a potential motion to approve the site plan and special use permits, but accepting grade parking spots 3 and 4 will remain lawn. Shannon, I hope you're getting this down because this is confusing. Good luck doing the minutes on this. And paving everything new 5, 6, 7, 8, and everything back to the garage in 1 and 2. So I see a motion from Kelly on that. Oh, and also contingent on revised final plans being submitted to Tito for planning department acceptance and approval. So I see a motion from Kelly to make that. I'll see Kyle as a second on that. All those in favor on that site plan approval and special use permit with those contingencies? I see 5 yeses. Any opposed? No. Okay, perfect. So it passed 5-0.
Thank you,
Tito,
guys.
good luck with that. Fun. Okay.
All right. Council, you're very wise. I appreciate your input.
Thank you.
Thank you.
Okay. But yes, to build on something that Greg just said, we probably should going forward not get in the habit of making bargaining and deal making back and forth here. All right, so our last presentation for the evening will be Fairview Recovery Services with a project address at 110 Fairview Avenue. Before the applicant begins, as happened last month, because I live so close to this project, within half a mile, I'm going to be recusing myself and stepping away. But before I do, I will gladly entertain a motion to elect an acting chair to run this portion of the meeting in this public hearing. So do you hear any nominations to elect one of the 4 people left here to serve as?
We can't nominate Tito.
I'm afraid not. It's got to be one of you 4 suckers. All right. So I'll nominate Joe to serve as acting chair while I step away for a recusal. Do I see a second for the nomination of Joe D'Angelo as acting chair from Manny? All those in favor of Manny as Joe D'Angelo as acting chair? 5-0. So Joe, the chair is yours, and I will be stepping away.
So we start with presenting the project.
Yes. Yeah.
Any changes since the last meeting? Ask that. Okay. Hey, I'd like to do that first, ask for changes, then. Yeah. Yeah. Has there have been any changes since our last discussion?
Better?
Yes.
Yes, on the northern parking area, we deleted 4 spaces.
Okay, thank you.
And we also showed the landscaping on the north parking area entrance. And then we also showed the additional landscaping along the property.
Okay. Thank you. With that, I'll open the public hearing and ask that anyone wishing to speak on the project come forward. And we'll hold the 5-minute plan for discussion. And once everyone comes forward and we get your comments and suggestions, we'll close the meeting and ask you to come back and discuss any items.
Okay, thank you.
Thank you. Okay. And whoever comes up, please introduce yourself and so everyone knows who's speaking, and we appreciate your comments.
My name is Anthony Mazza. I live at
Name?
11 Clapham Street with my wife. She's sitting up in the audience. We've been at that address for 52 years, all right? It's a wonderful place to live up there, all right? I can't in 5 minutes defend my position. I wish I could. All right, we love it up there. So do a lot of other people up there. Most of the people up there are, I'm going to use the term, and it's a metaphor, they mow their lawn. They plant flowers. It's nice, you know, but there's been some growth as far as recovery services up there, you know, in the, well, I'd say within the last decade. In 110 Fairview that you're looking at, there was 2 men assigned there that were criminally convicted of assaulting women, well, young girls, all right? It's been hard.
Could you speak a little louder right into the mic, please? Thank you.
At 110 Fairview, all right, which is part of their complex, I believe. I'm not sure, you know, and everything, right? It's very hard to understand where this project even stands or what they're doing. The project they were gonna, you know, do, you know, and everything, right, at the corner of Merrick and Fairview, you kind of have to talk about the area that it is, you know, and everything, right? Was approved in December of 22. I don't know if that's still valid. There's no information provided to anybody as what's going on up there or anything. You know, for me to comment on this, you know, when I don't really know what's going on is difficult to do. But for the most part, I don't know one person up there that lives up there that favors this plan. Now I'll openly admit that I haven't sampled everybody. I haven't. I know of the houses, there's 10 of them that are around the Clapham, East, Merrick, and Fairview. There's 10 houses, 8 of them are opposed to it. There's one that I've never been able to contact. They're on Merrick. And there's a woman over in the corner of East on the bottom who I talked to about it, and she said, I'll look at it. And that's what I've got. I've talked to some people who live on there's a second layer of property up above it, which is very nice property, right? They mow the lawn too, you know, and everything. And I've only a couple people up there, and I've talked to people who are in what Foz is built on top, which is more like condominiums. But I've only talked to a couple up there, you know, and I haven't openly gone to everybody or anything like that. And they are openly against it. There's women up there. You know, there's women up there that are afraid. At the last meeting, were you at the last meeting? You were there. There's a woman who was literally afraid because they walk around up there. Now, I'm not against people getting help. I'm not. My wife and I are not that way. We believe people should get help. We've offered suggestions on where they could put this. One of the suggestions was, you know, St. Mary's, which was on sale, which would have been ideal for this. It has a full gym. It has a kitchen with ovens and a range with H-jets on it, with refrigeration, with dishwashing, which has a court where these men could have used to just get a little, their energy, expended. There's no court up there. There's nothing. Pool table, maybe cable TV. There's nothing up there for these men. This doesn't benefit the people you're trying to help. This doesn't benefit the people you're trying to help. I own the land on the other side of the street. All of it. I bought it off Dr. Bolt. Dr. Bolt loved that land. Getting that land off him was a difficult task. Difficult task. You know, I can't afford my property value going down. I've never seen them post anything which says my property isn't going to lose value. Ask him. He's got a high intensity light on up there, which shines on my property. The city can't do anything about it because they said there's no window there. And it shines all the way up the street. I mean, what do I do? How do I sell it? Do you want to buy some land up there? Does anybody want to volunteer to buy that land at a realistic price? I can't in 5 minutes tell you all of the reasons why I don't believe in this, although I believe in those people getting help. The building behind St. Mary's go look at it. It's unoccupied. It's abandoned. They could have built a brand new building there. They could have had a brand new building. They could have had a recreational facility. There's a building right next to it, which is already constructed. And beyond that, there's a building that lawyers used to occupy. Tons of parking. You know, I'm not NIMBY. I'm not NIMBY. I believe in help for people, but when you help, don't hurt.
Well, we thank you for your.
Don't hurt.
Comments.
I'm sorry.
We thank you for your time and comments.
I'm sorry, I can't
No,
hear you. Mr.
we thank you for your time and comments.
Okay, I thank you, gentlemen.
Thank you very much.
Thank you.
Would anyone else like to speak? Welcome.
Okay. Yeah, you want to go before me? No,
Hello. My name is Becky Ewing. I live at 22 Clapham Street, which my property is right across off of East Street. And then there's a wooded area and then the halfway
Could you
house.
speak right into the mic a little bit?
Okay.
Thank you. Thank you.
And I don't remember everyone from the meeting from December of 22, but we had written quite a few letters concerning the safety of our neighborhood with the cars and the increased volume of things going. And our roads are really just country roads. Clapham, there's no sidewalks. There's just ditches, not really gutters. And on East Street is really just an old, it's a block, and it's just some paved asphalt. There, again, no gutters or sidewalks. I do appreciate after a year and a half ago, when we were going through all of this, and Tito, I'm sure he has on my letters from before, because there is issues with people with wheelchairs from up above coming down that road and how unsafe it is. And so you could go back and read those if you like. And basically, I just met Patrick. I've talked to him a couple times on the phone. And my concern, and I know, actually, we were just notified last week that there was even a meeting here. I didn't know that this was delayed, that it had run the year for it to have the construction started until I talked to Patrick, and he said, I'm getting a dry mouth, sorry, that it was due to some drainage issues that they had to redo and move things around on the property. And they are keeping the green space, which I'm very happy for, because we are residential, and it's just not what I want to see is the comings and goings of this residential area made into a commercial business area. And that's fine. And I appreciate what they did change. From the meeting a year and a half ago, one of the things I was really concerned with is when they initially did the 2015 or 16 add-on of a building that was supposed to be for women and their children. We had no problems with that. Actually, it would make it more like a friendly family place to be able to have these people in recovery, have their families with them. And it didn't last long. They had issues. They mentioned them a year and a half ago, which I can hardly remember, but it was not working out to have children up there. So they ended up, that didn't happen. And that is my only concern, is what down the line, if they change or build, are they going to do what they need to do to get it done and then change what the use of it is for? And although Patrick, I talked to him on Friday, because I said, I just need a guarantee that this is it, that you're not going to go any farther, that you're going to keep that green space. Tony is the only one that really suffers because his house is really across from it on Clapham Street. And I feel badly for him because he does see a lot more of the activity. But I'm putting this out there because I want to guarantee that you're done. And the chair from that meeting a year and a half ago, I remember you approved it, but he said, don't come back with anything else. This is it. I want to go on record getting that guarantee and making sure that this is it and that we don't have to keep coming back and trying to preserve our neighborhood. Okay, is that? Oh, okay. So that's it. It's my neighborhood. I've been there for 32 years. A lot of us have been there for a long time. And it's some of the new comings and goings that we have questions about. And we just want to keep it safe. Just need a guarantee that they will protect us and keep us safe.
Thank you.
Thank you very much.
Thank you.
Thank you.
Anyone else like to speak?
Hi, everyone. Sarah Campbell. I represent the applicant and did represent them in the initial prolonged process associated with this application. I think it's helpful for me to clarify actually why we're here tonight. So this project was the subject of months and months of public hearings and other public meetings associated with the approval of a special permit for a social service use and site plan review. The only reason we're here tonight is because when we did the fine engineering of the site, we want to avoid a 12-inch storm line. So we're moving the building 10 feet over. That's it. We're also moving a driveway a little bit over just to get it away from the intersection. That's the only reason that we're here tonight. Not to revisit the special permit, not to revisit the use, just for a site plan modification to move the building 10 feet and to move the parking lot over a little bit farther away from the intersection. The only change from anything other than those two things is because we're moving the driveway a little, we're going to lose 4 parking spaces. We have the ability to put them in the north side of the building, all right, on off Clapham. We don't want to do that. We don't want to take the green space away. We don't want to take the existing landscaping away. And we meet our parking requirement without those 4 spaces. So really all we're asking for you to do tonight is to move the building 10 feet, move the driveway a little bit, and not to pave those parking spaces off Clapham. That's it.
Thank
Okay,
you.
Thank you.
Thank you.
Any,
We
Anyone else?
need to close the public hearing if no one else wants to speak.
okay, that, well, a question?
Okay, come on down.
Good evening.
Hi, my name is Kathy Gross. I live at 15 Merrick Street, which is up the street. The last meeting that we had, we thought we had everything in the community. We thought everything was decided. I was pleased that they've made major changes. I'm very pleased about that. I'm also very pleased that you want to work on that drainage because it's god awful at Merrick and Fairview. But we were told before that that building, that all this construction it's going to take a building down. Is that still coming down? We don't, in the neighborhood, don't know what's going on. It is? Yeah. Okay. So if, I appreciate everything you're doing, but if the neighborhood could be made aware of what you're doing. As Mrs. Ewing said, a sign went up. We got a letter. That was it. We thought in the community up there, it's a very small community, that everything was set. This caught us by surprise. As I said, really hope you can fix that drainage because it's awful. And if that building is coming down, then I appreciate that. But we just want you to move on it. Just, no offense, but just do it. Do what you say you're going to do and do it. So that's all.
Okay, thank you.
Thank you.
So I'll close the public hearing. If there's no more, anyone else to speak? And with that, we'll ask to come back, the group to come back up for the project. You could come back up. And do you want to address anything more or discuss anything?
Yeah, no, I think we're clear. We're good.
And just one question I have about the 12-inch drainage line. What was the reason to avoid that?
The drainage line is north of our building, the pink building on there, between there and the adjacent building up the hill. And we did not want to relocate it. It would have added considerable amount of, it's on property. It's not on city property. It runs through the middle of our property. So by sliding it down 10 feet, we were able to eliminate removing it and relocating it.
Okay, thank you.
I'm good.
Any questions from any of the members?
So you're asking us to give you an allowance to not have 2 parking spaces, is that correct? 4, okay. So that you wouldn't have to go into the green space.
We're required by our square footage to have 39 and we're providing 51.
Okay, and then to move the building over, and those are the 2 things that.
10 feet.
Okay,
And that's what considered it to be a major change to come back here, was that the movement of
The moving of the building, the
structure?
building is a little bit smaller also, and then
Okay.
the moving of the ingress and egress to the site off of Merrick.
Okay. Thank you. Any-
A little smaller.
yeah. Manny, what do you?
So it's no change in use type or
None
occupancy?
at all.
None at all.
Okay.
No more beds or anything.
It didn't change the number of beds or rooms or anything.
No, it
Just-
did not. It's still for 20 beds.
Okay.
We reduced the cost by reducing the square footage because it's every day it goes up.
Okay,
My thoughts are, I don't know what the commission proposed this, but that with the neighborhood in mind, that we would give that allowance to keep that green space that might facilitate the neighborhood's wishes and needs. That's my thought.
you're saying this accommodates that, in your opinion?
I would think that that would be helpful.
Okay.
I don't know what the other
Okay.
commissioners think.
Thoughts
So you're
of it?
proposing motioning,
Yeah.
but with that contingent
Yes.
in mind? Okay.
Let me pull up the secret form.
Legals.
It's down here.
Manny, what do you think?
Come over. Oh, come over.
You want to ask the applicant if they're
Yeah.
okay with that?
Okay.
I think that that's.
Well, given the discussion we had, I'll make a motion to declare this, to make a negative declaration with regard to seeker impact. And go through each of these items.
Did we declare lead agency yet? Okay.
Okay, so the first one will, the proposed action create a material conflict with an adopted land use plan or zoning regulation? No or small impact. Will the proposed action result in a change in the use or intensity of use of land? No or small impact. Will the proposed action impair the character or quality of the existing community? No or small impact. And again, the proposed action is to change what's been described as a change in the location and the building. Will the proposed action have an impact on the environmental characteristics that cause the establishment of a critical environmental area, CEA? No or small impact. Will the proposed action result in an adverse change in the existing level of traffic or affect existing infrastructure for mass transit, biking, or walkway? No or small impact. Will the proposed action cause an increase in the use of energy and it fails to incorporate reasonably available energy conservation or renewable energy opportunities? No or small impact. Will the proposed action impact existing public-private water supplies or public-private wastewater treatment utilities? No or small impact. Will the proposed action impair the character or quality of important historic, archaeological, architectural, or aesthetic resources? No or small impact. Will the proposed action result in an adverse change to natural resources, wetlands, water bodies, groundwater, air quality, flora or fauna? No or small impact. Will the proposed action result in an increase in the potential for erosion, flooding, or drainage problems? No or small impact. Will the proposed action create a hazard to environmental resources or human health? No or small impact. So
I think based on,
make some motion to adopt that now.
Yeah, based on our discussions over the previous couple years and based on our discussions, I'll make a motion to issue a negative declaration.
Second? Second. All in favor?
Aye.
Four, was that enough? What, four?
So now you have to make a motion to waive for parking spaces.
Thank you. Thanks for your help. I'll make a motion to waive the 4 parking requirements and that that the site plan requirements are met.
I'll second.
Good. And with that, all in favor?
Aye.
4-0. Carries. We don't have 5, right, which we're good. We don't need 5 floors. Okay, thank you. The motion carries. Thank you. Thank you. Motion carries.
Yeah.
Yes.
Yeah.
Yeah, that'll, it was a bit inartful, but yes, they approved the changes.
They're approved.
Sorry.
Thank you.
Okay.
Not typical meeting.
Yeah, for other business, you want to go in there? Okay.
Okay, so Tito, we have one last item on our agenda this evening, and that would be something about the Clinton Street rezoning. Do you want to fill us in on what we're going to do tonight?
Sure. So we were made aware of a potential project to construct grant-funded housing at a vacant property in this area, and that would not be allowed under the current zoning. It's an industrial zoning district. So that prompted us to review the zoning for that lot in the surrounding area. And we found that the comprehensive plan recommended that it be rezoned. This would be us doing that rezoning to conform with the comprehensive plan and to allow this housing project to move forward. But again, comprehensive plan called for the area to be rezoned. So
This would follow the comprehensive plan.
correct. So what we would be looking for from the commission is a motion to recommend the rezoning to city council, or to recommend that they not adopt it, or to recommend that they adopt it with certain changes.
So Tito, can I ask some questions about this? So I'm looking at the map.
Yep.
I don't know if this is going to be helpful. So I'm seeing 3 blocks that are marked for rezoning. So first, there's a purple block outlined in light blue, marked rezoned to I-1 Urban Business Park.
Correct.
So what is the current purple and what does what does that mean if it's going from I-2 to I-1? What does that mean?
So I-2 is light and medium industrial, and that's kind of your general industrial users, not super heavy noxious stuff, but lighter manufacturing and things like that.
Machine plants. Like machinery shops kind of thing?
Yeah, that would fit. That's what that area outlined in blue currently is. Rezoning it to I-1 Business Park allows some a more greater variety of uses. So it allows multi-unit housing. And it focuses more on clean and high-tech industry versus general industry.
There's also 2 other chunks that are purple but outlined in lime green.
Correct.
And they're going to be changing from I-2 to C4. Can you explain what that means?
Yep. So C4 is neighborhood commercial. So that's sort of lower intensity neighborhood commercial uses. And if you look at the red surrounding basically up and down Clinton Street, that's what that is. So we would be annexing those green areas to the existing C4. And what that would do is allow mixed use buildings to be built there. So they could have storefronts on the ground floor with apartments above. Whereas again, right now, because they're industrial, it can only be industrial, no residential's allowed.
So to use one, if I'm looking at this map correctly, in one of those purple to lime green proposals, I-2 to C4, that's the Boys and Girls Club building? Am I reading that map correctly? So are they improperly zoned?
Yeah, I would say that is improperly zoned, because if you look at that rectangle, that's the Boys and Girls Club, and 1, 2, 3, 4, 5 residential buildings. So there's no industrial there.
Are you trying to kick them out?
I guess I want to make sure that, like, you know, my bigger question is, so we're going to be helping people who are currently in violation of the zoning laws is currently mapped out?
They're legal non-conforming. They're grandfathered in, so
Okay.
they can be there, but in one of those residential lots, for example, if they wanted to add an additional unit, they could not do that right now. Whereas if we rezone it, they could.
Okay. In the other two spots, I guess I'll call this like south of Clinton Street on this map.
Mhm.
What is the current status of these buildings? Are there current owners, current tenants that are going to be negatively impacted if we're like, haha, we're changing this from I-2 to I-1 or I-2 to C4?
Yeah, so the 2 Titchener Place is the one outlined in blue. That's currently vacant. It's been vacant for a long time. Going from I-2 to I-1 will allow actually more viable uses. So it could potentially make that more developable than it currently is. And then if you go east, that's a big vacant lot, which is where the proposed mixed-use building would be if that moves forward. And then beyond that, is
It says Matthews on the Parkway on my Google map, but I don't know if that's current.
I want to say that that's the recycling place. But that would be allowed to remain.
So two more questions for you, Tito.
Yep.
So you've hinted a couple of times that there's a mixed use, there's a housing development building that somebody out there is dreaming of for this south of Clinton I-2 to C4 block. What do we know, or what are we allowed to know about this? Or is that going to come before planning at some point? For example, knowing what may or may not be coming down the pipeline in 6 months, could that impact whether or not we want to recommend to the city council to rezone or not rezone? You know what I'm saying here?
So I believe they will be on the next agenda. They have until the end of this week to submit their application. It's part of a larger plan to provide housing in the area. I don't know, honestly, how explicit I can get. But it's part of it would be part of a grant application to provide housing, rehabbed housing and new construction.
I'm only going to speak for myself. I'm not going to speak for anybody else here. I am nervous about opening floodgates to things that I don't know. So at the moment, I'm probably gonna be casting a vote against rezoning this. Are you looking for
a recommendation?
Or are you looking for like changing all 3, change 2 of the 3? Like, what are you looking for here?
Anything in between. So you could recommend rezoning as presented or recommend rezoning only certain parts of this. It's up to the commission. Again, this is also supported by the comprehensive plan. So
Can
it's
we
not
table
all
it
being
so
done.
we find out what the other applicant is?
I mean, it's really not
Sorry.
supposed to be based on a particular application. It's that kind of veers into sort of spot zoning territory. So I do want to stress that the area in its entirety is recommended to be rezoned because according to the comprehensive plan that took into account a lot of public input, it's over a year-long process. It was determined that this was improperly zoned as industrial and it should instead be neighborhood commercial.
I guess the comment on or how that was.
This will require a public hearing, but city council, who is the body that will officially vote on this, they'll be having the public hearing.
Just to clarify, where the public input came, up, comprehensive plan that made the recommendation.
Where did it come from?
Yes, yep.
From public events. So over the course of, I think it was like a year and a half, there was public input solicited. There were several events held downtown and other places, library, where people could come in, people from the public could come in and comment on ideas as the consultant who did the comprehensive plan was developing it. So it came directly from residents.
I'm fine with moving forward and recommending the rezoning as presented personally. I'll make a motion.
Okay,
to,
there's a motion to, what do you
recommend-
want, what do you want the motion officially read, Tito?
Uh,
That we recommend to city council that they approve the rezoning proposal?
Yes.
All right, so Manny, you're
Okay.
making that, yes, city council, please approve the zoning proposal. We recommend it. Okay. And do I see from Kyle a seconds? All right, all those in favor of recommending to city council that they approve this rezoning proposal, say aye.
Aye.
I see 4 ayes. Any opposed, say nay. I'm on the record as a nay. So it does pass 4-1. We're a recommendation to city council to approve.
Great.
I don't see anything else in the agenda, Tito. So at this point, unless somebody else jumps in here, I would accept a motion to adjourn. Kelly, seconded by
Second.
Manny. All those in favor, say aye.
Aye.
Okay, we are adjourned. See you all in May.